Let's talk about the studies that show 75% cure rate of POTS using exercise. POTS, or postural orthostatic tachycardia syndrome, cases are rising, especially lately. And so it's really important to remind everybody that we do have very strong data that show that this is a reversible condition. There are two groundbreaking studies that I'm going to go over. In one of them, it's from 2010. It shows a 53% cure rate. And another one from Harvard in 2021 showed a 75% cure rate. Hi, I'm Dr. Zaldivar. I have a Ph.D. in nutrition and exercise physiology from the University of Miami. I was featured on the first ever carnivore diet TV show, Reverse TV series, and I've taught for over a decade at the University of Miami and the American College of Sports Medicine and other places. And I've coached thousands of clients, and you can check out the testimonials on my website. And I really specialize in raising baseline dopamine levels, and that's the way that I was able to lose 30 pounds and maintain it. And one of the main ways that I help my clients with addiction and weight loss issues. All right, let's talk about POTS. What is it? It's a condition that causes a number of symptoms when you stand up from lying down, or if you're sitting and you stand up, you have symptoms such as a fast heart rate, lightheadedness, dizziness, and fatigue. And interestingly, you don't see an accompanying drop in blood pressure. So you just have those symptoms without a drop in your blood pressure. It's more common generally in women, especially if they're premenopausal. However, since 2020 and everything that occurred around that year, we are seeing similar cases among both men and women. In these groundbreaking studies, the authors hypothesized that POTS is caused by weak hearts or smaller hearts or deconditioned hearts. So the more sedentary you've been, the less you've worked out in your life, there's a good chance that your heart might be too small, and that sets you up and makes you more vulnerable to develop POTS. So they hypothesized that POTS is due to a weakened or small heart and accompanying low blood volumes, which is why the heart rates go up in an effort to counter the weakened hearts by pumping out enough blood to fuel the body. So the weaker and smaller the heart, the more times it needs to beat in order to deliver enough volume of blood to give enough oxygen and nutrients to all of your tissues. And so it's very easy to see how exercise can treat the root cause of that, because exercise, specifically cardiovascular exercise, strengthens the heart muscle specifically, and it enlarges it and it makes it thicker. So the walls of your heart become thicker. So now with every pump, your heart can empty out all of the chambers or a lot more of the chamber, and it pumps out a lot more blood to deliver enough blood volume that carries enough oxygen and nutrients to all your tissues. So your heart doesn't have to pump as many times as compared to somebody with a weaker and thinner heart muscles. In the first study that I'm going to go over, which is from 2010, they showed a 53% cure rate of POTS. And at the end, the authors say that if we continue with this exercise program and we keep getting our subjects stronger and we give them longer cardio and more intense cardio, we think that all of them should be cured. It's just that they did it for 3 months, and at the 3 month mark, 53% were cured. So that's very exciting. So exercise training increased blood volume and plasma volume in these patients, which is a well-known effective exercise. And also the heart increased in size, because again, cardio specifically targets the heart muscle, it strengthens it and makes the heart walls thicker and stronger and more efficient in their work. So the left ventricular mass, meaning the last chamber from which the blood leaves the heart, which is the left ventricle. The ventricles are the lower part of the heart chambers, and the atria are the upper parts of the heart chambers. So the ventricle, specifically the left ventricle, is the last chamber from which the blood leaves your heart to be delivered to all of your body. So the left ventricular mass also increased significantly after training in POTS patients, which is exactly what we would expect to see. The heart muscle got bigger and stronger, and it was no longer different than the controls or the patients who did not have POTS. And also both supine, meaning on their back, they were lying on their backs, and a 10-minute standing heart rate. So when they would stand up for 10 minutes, so the heart rate's on their backs, and when they would stand up for 10 minutes, their heart rates decreased markedly after short-term exercise training. This study, by the way, was published in the Journal of the American College of Cardiology. So before the exercise was conducted in the study, blood and plasma volume was about 20% lower, while left ventricular mass was approximately 16% smaller in these patients compared with healthy sedentary controls, which is exactly what the authors hypothesized. They hypothesized that people who have POTS tend to have smaller, weaker heart muscles, and the data showed that that was true. And I'm going to quote one of the authors, and they said, "It is important to emphasize that even the sickest patients participated in this program, and that training was facilitated by avoiding upright exercise in the early stage." So if you're watching this and you're worried because you're feeling the effects of POTS, it's really exciting to see that even the sickest of patients who participated in the study were able to work out no problem. But here's the trick, is that they did not give them running and jogging right off the bat. They did not give them upright exercise right off the bat. They started them off with recumbent bike exercises. So you sit on a bike, or rowing, or swimming. So those are forms of cardiovascular activity that did not trigger the symptoms as much, if any at all. The study lasted for 3 months, and they gave them progressive, and that's the key word, progressive exercise training. So it's about constantly increasing a little bit the intensity and the duration of the cardiovascular exercise, so that they would constantly push the heart muscle to get stronger and stronger and stronger over time, and bigger and bigger and bigger over time. They started them off again on a recumbent bike, and they progressed them from those lying forms of exercise to walking, then jogging on the treadmill. This is the exercise protocol that they used. The majority of the training sessions, particularly the early phases, were prescribed as base training with target heart rate equivalent to around 75 to 85% of their maximal heart rate. In other words, you get your maximal heart rate. The equation to get your maximal heart rate is 220 minus age. This is just a rough estimate. So let's say you're 20 years of age, you do 220 minus 20, and that means your maximal heart rate is estimated to be around 200 beats per minute. And you make sure when you're training, you do 75 to 85% of that. So you do 85% or 0.85, multiply that by 200, and you will get your target heart rate with which you need to be training at. Initially, patients trained 2 to 4 times a week for 30 to 45 minutes a session by using a recumbent bike or rowing or swimming. So anything to not trigger their symptoms, so no upright cardio. And this is again important. The use of only semi-recumbent exercise at the beginning was a critical strategy, allowing patients to exercise while avoiding the upright posture, which elicits their symptoms. As the patients became relatively fit, the duration of the base training sessions was prolonged, and subsequently sessions of increased intensity were added first once and then twice per week, and were always followed by recovery sessions. So very, very slowly they progressed them. Upright exercise was added gradually as tolerated, though usually not until the second or the third month. So you really want to be patient with yourself and give yourself a couple of months of getting your heart stronger by using a recumbent bike or rowing machine or swimming. And then you start adding 10 minutes, you start substituting 10 minutes of that recumbent bike exercise with 10 minutes of upright cardio, such as walking, and then eventually you want to jog, and then hopefully you can run. By the end of the training, patients were exercising pretty much every day, 5 to 6 hours per week, and they were encouraged to use an upright bike or walk on the treadmill or jog. In addition to the endurance training, they also gave them strength training, so they gave them resistance training using weightlifting. Weightlifting started from once a week for 15 to 20 minutes per session, then gradually increased to twice a week, 30 to 40 minutes per session. Additionally, patients were encouraged to increase their dietary salt intake to 6 to 8 grams per day. So they were giving them a lot of salt as well to increase their blood volume. So 6 to 8 grams a day is a lot of sodium. So I highly recommend you download an app like MyFitnessPal and you input the foods that you're eating, because it can give you exactly how many milligrams of sodium you're consuming per day. Most of the time, you're probably going to be eating 2,000, 3,000, maybe 4,000 milligrams of sodium. In other words, maybe around 4 to 5 grams of sodium. So you need to go a little bit higher than that in order to increase your blood volume a little bit faster. Just do it gradually. Don't go from a low sodium intake to very high overnight. You want to gradually increase the amount of sodium that you're consuming and see how you tolerate it. And they also gave them 3 to 4 liters of water per day, which is, again, a lot of water. Most people really don't get this amount of fluids every day. So you want to make sure you're not even mildly dehydrated, because that's going to trigger your symptoms. And then you want to elevate the head of the bed during sleeping at night, because that increases blood volume and helps offset symptoms as well. The results of this study showed that 53% of the patients, which were 10 out of the 19 patients, no longer met criteria for POTS after completion of the 3-month exercise training program, and thus were cured. We speculate that more prolonged and more intense training may be necessary to further reduce upright tachycardia in those patients. Tachycardia meaning a fast heartbeat. So the authors go on to say that, yeah, 53% were cured, but if we kept on going with these patients, the rest of the patients, they should all be cured by the end of it. It's just that some people might need a little bit more exercise, a little bit more intense exercise, a little bit longer exercise to strengthen their heart muscles even more to completely eliminate symptoms of POTS. And so, yeah, obviously my recommendation is going to be, if 3 months does not cure your case, then just keep increasing your intensity and the duration of the exercise. Make sure you're doing that under the supervision of a doctor or a health professional to ensure that you're taking all the proper precautions and making sure you're not triggering an episode at the gym. The other study was out of Harvard, and it showed even better results, 75% cure rate of POTS. And this was the result, and I'm going to quote the authors: more than 75% of subjects in the treated group did not have POTS at the study conclusion. In other words, they were cured of POTS by the end of the study. So this came out in 2021, and this was the exercise protocol that they used in this study. Subjects began exercising on a recumbent bicycle. So again, always start with lying down or a semi-recumbent, semi-lying down position. So something like a recumbent bike again, or a swimming or rowing. So they started them off on a recumbent bicycle for 10 minutes per day, 6 days a week. And every week they added only 3 minutes of exercise until they reached 45 minutes. After 3 months or 12 weeks, participants were exercising for a total of 45 minutes per day, every single day, pretty much 6 days a week, on a recumbent bicycle. If subjects did not have access to a recumbent bicycle, a rowing machine or swimming was offered as an alternative option. And then after the 3 months, so starting on week 13, subjects added 10 minutes of upright exercise on a treadmill or an elliptical machine per day, or they gave them brisk walking and running outdoors if no equipment was available. Also, pretty much every day, 6 days a week, and reduced their time on the recumbent bicycle by an equal amount. So they were doing 45 minutes on the bike. So on week 13, they started doing 35 minutes on the bike. And then the last 10 minutes would be something upright. Each week, participants added 3 minutes of upright exercise until week 24, when they were exercising for 45 minutes per day, 6 days per week in the upright position and off the recumbent bicycle. Subjects were asked to continue the upright exercise 4 to 5 days a week for 45 minutes upon completion of the protocol. Intensity of exercise was recommended as minimal at the study initiation, with a gradual and, again, progressive increase in intensity as tolerated after 4 weeks. So they started them off with very, very low intensity cardio. And then at the end of the first month, they really started increasing the intensity gradually on the recumbent bikes, and then eventually transitioned them to upright exercise, and also kept on increasing the intensity of the upright exercise. You start off walking, then over time you start jogging, then over time you start running. And the intensity with which you need to train at is really variable. The weaker your heart, the more intense you need to work out in order to completely eliminate the symptoms of POTS, and in order to strengthen the heart muscle and thicken that heart muscle wall enough so that you no longer have the symptoms of POTS. This was the graph that they put in the paper of the exercise protocol. You can see it was 6 months long. started off with seated, and then starting around on week 13, you can see here they remove a little bit of the seated, they replace some of the seated exercise with upright, and then they gradually start to increase the amount of upright exercise and decrease the amount of seated exercise. And then at the end of the 6-month protocol, they advise all of the patients to continue working out 4 days a week for a minimum of 30 minutes to maintain all the gains in their heart muscle strength that they have received. Now, one more important thing, you really want to increase salt intake. So it's called salt loading. Salt loading in patients with POTS has been shown to increase plasma volume and orthostatic tolerance. So that's a very quick and easy way to increase your blood volume. And POTS patients who have normal cardiac and renal adrenal function are recommended to gradually increase their daily salt intake by using dietary salt up to 10 grams per day if tolerated. So you want to go slowly and progressively increase the amount of daily sodium intake that you're consuming. And salty snacks, I highly recommend you take it easy with the carbs and instead try to find salty snacks like bacon or pork rinds or things like that that are super high in salt. You can get electrolyte mixes as well. Those are all helpful. The authors in this paper also recommend that you avoid salt tablets because they are very concentrated and can induce an osmotic load into the stomach, which may cause nausea, vomiting, and dehydration, leading to reduced rather than expanded plasma and blood volume. So instead of taking salt tablets, try to get it via fluids like electrolyte mixes and increasing salty snacks and increasing just the amount of salt that you're adding to your food. In addition to that, you also want to increase the amount of water that you're consuming, so up to 3 liters per day. I would go as high as 4 liters, especially if you're consuming all the salt. That would be even better. And that increase in your salt and water intake throughout the day is going to really be the thing that's going to increase your blood volume the fastest. And then you couple that with exercise, and you're doing really well at this point. This past paragraph was an excerpt from this paper. This is the same researcher. I think you would say his name is Chi Fu. Not Ki, right? Chi Fu. So he is the author of that first paper we covered, the one that showed 53% cure rate of POTS. So he does a lot of work on this topic. And I highly recommend also looking at your diet, and I recommend getting as close as possible to an animal-based diet, if not a full-blown carnivore diet. I will send you a free copy of my 30-day carnivore challenge guide when you sign up to my newsletter at drzaldivar.com/newsletter. And also, you may want to check out my guides that target my technique to raise your baseline dopamine levels. And I outline my protocol in these 3 guides: Dopamine Brain, Monster Mindset, and Monster Mind, the supplements. These 3 guides all have the goal of raising your baseline dopamine level. And I do have other YouTube videos that dive deeper into why it's so important to pay attention to where your baseline dopamine level is and how to raise it, whether it is to overcome cravings and addictions, to lose weight, to be better, more focused, more productive. All of those things come down to brain health and your baseline dopamine. And so if you're struggling to stick to any protocol, any exercise protocol, any dietary protocol, any kind of goal that you have, and if you're interested in working one-on-one with me, you can check us out on drzaldivar.com/coaching, and the guides are on drzaldivar.com/shop. Thank you, and you can watch these videos next. If you enjoyed this type of content, let me know so I can film additional content around it by giving this YouTube video a thumbs up, subscribing, and hitting that little notification bell icon so YouTube alerts you every time I post a new video. Also, if you know somebody that might benefit from this type of content, make sure you share them with your friends and family members. And thank you so much for watching, and I will see you in the next one.